swear or affirm the testimony you shall give will be the truth, the whole truth, and nothing but the truth, so help you God?
Yes, I do.
Okay, you can have a seat. Can you state your name and spell it, please?
Carly Blomquist, Carlomquist.
Okay. Do we want her to adjust her microphone down a little bit?
Yes.
Can you just pull that down just a smidge? Yeah.
Is that better?
Yes.
Okay.
Can you tell me how you're employed?
Yeah, I'm an emergency room physician at Northside Cherokee Hospital.
All right. And can you tell the jury a little bit about your educational background and training?
Yeah, I went to undergrad, pre-med at Emory University, graduated in 2005, and then I went to medical school at Medical College of Georgia, graduated in 2010, and then I went back to residency where I trained based out of Emory University at 5 different hospital sites, including Grady primarily, and then after that, so I finished that in 2013, and I've been a practicing ER physician since then at Northside Cherokee, so for a little over 10 years.
Okay. And in your practice as an emergency room physician, what does that mean?
So a lot of things. There's a variety of patients that I take care of. I don't work at a level 1 trauma center anymore, but I trained at Grady, which was one. We do get occasional traumas, but we don't get the bigger traumas unless they're very, very critical and they have to come to us. But I take care of heart attacks and strokes and sepsis patients, and occasional traumas, car accidents, and then basically patients that are they lose their pulse on the way to a trauma center, so they have to come to us instead.
Okay. And you say on their way to a trauma center. Northside Cherokee ER is not a trauma center?
It's not.
Okay. And does that influence what types of patients are brought to you in an emergency setting?
Yes. So if there is a serious trauma, then they should go to a trauma center if they can make it there. But if they can't make it there, they go to the nearest ER.
Okay.
But at Grady, which is where I trained primarily, I was there for 3 years. That's a level 1 trauma center, so I do have a lot of experience with trauma patients.
Okay. Your Honor, at this time I would tender Dr. Blomquist as an expert in emergency medicine.
That brief exchange may have sounded routine, but it's actually a major courtroom moment. Once the judge accepts Dr. Blomquist as an expert in emergency medicine, the jury can give significant weight to her professional opinions, not just her observations. In other words, she's no longer just a witness describing what she saw. She's qualified to explain what it medically means.
No objection?
So noted.
I want to talk to you about December the 8th of 2020. Have you had an opportunity to review your records from your treatment of Hannah Nicole Driver?
Yes.
Okay. And do you remember that incident, her coming into the ER?
Yes.
Okay. Do you remember that independent from your records review?
Yes, I just reviewed the records yesterday for the first time, but I recalled before that.
Okay. And tell me, apart from your review of the records, what you recall in terms of your memory of responding to that incident.
So I was an assisting physician on that case. The primary physician is one of my colleagues I've worked with for 10 years, but I came into shift and there was a crowded room, so I jumped in to see how I could help. So I entered the room and I saw Hannah, and they were securing the airway when I entered the room, and then I just jumped in to see where I could help basically in the resuscitation efforts. Her clothes were bloody, CPR was in progress. I could see stab wounds on the neck that were no longer bleeding.
And carefully to the details here. The doctor isn't describing a patient being evaluated. She's describing a full-scale resuscitation attempt. Multiple medical professionals, CPR in progress, airway management, emergency access points being established. Every second matters in these situations, and the testimony paints a picture of a team already fighting against overwhelming odds.
And there wasn't any apparent sign of life. Dr. Albinger had already secured one access in one of her legs, and so I did it in the other leg so we could have more access for medications. And unfortunately, after all the attempts that we tried to get her heart back beating, it was very clear that that wasn't going to happen. I performed the bedside cardiac ultrasound, which we do a lot of times during ACLS before we call it, and we could see that there was no cardiac activity, so then time of death was called.
Okay. You indicated when you entered the room that they were securing an airway. What does that mean?
Intubating, putting on the ventilator machine. So basically, it's just a process that we do where we put an ET tube into the airway and connect it to the ventilator, or bag them until we get life back, basically, and then we'll connect it to the ventilator machine.
Okay. And you indicated when you entered the room, you entered into a crowded room. How many people were working on Hannah?
This is one of those medical details that can sound technical, but is incredibly important. When doctors can't quickly access a vein, they can deliver life-saving medications directly through the bone marrow. The fact that they had to use this emergency procedure tells you just how critical the situation was. Have you ever heard of medications being administered through bone access before? It's a reminder of how far emergency medicine can go in an attempt to save a life.
I don't recall exactly how many people. I would guess around 10, but I don't really know.
Okay. And then you said Dr. Albinger had secured access through one of her legs. What does that mean?
Yeah, so from what I read in the documentation, they were unable to get any peripheral IVs en route, so they didn't have any access to her venous system in order to give the medications that we have to give to get the heart beating back, like IV fluids, epinephrine, bicarb, which is what she had received. So we have to have access somehow. So in an emergency situation, when we can't get access in the veins, which often happens when they don't have any blood, we get access into the bone. So there's a drill that we use in order to gain access into the bone of the leg, and then we can give medications or blood or fluids in that area.
Okay. And you indicated that sort of at what point after getting those access points, securing the airway, at what point did you all shift to the cardiac ultrasound to make decisions about whether to continue life-saving efforts or call a time of death?
I believe it was 1502 from the documentation, but I don't have it in front of me.
Okay. If I show you your record,
that would be
help?
helpful, yeah.
May I approach?
Yes.
I think that's when I placed the IO, but let me see.
This is arguably the most powerful medical testimony in the entire examination. The doctor explains that even during chest compressions, there wasn't blood being pushed from the wounds. Her conclusion is devastating. There simply wasn't enough blood left in the body to circulate. For jurors, this kind of testimony helps answer a key question: whether any realistic medical intervention could have changed the outcome at that stage.
Patient arrived to the ER at 1444. Looks like the patient was intubated at 1500, and that's around when I would have entered the room, because I remember that. And then at 1502 is when I placed the IO in the right knee.
And what is the IO?
The intraosseous line that I talked about with the drill.
Notice how precise everything becomes here. Arrival time, intubation time, ultrasound time, time of death. In a courtroom, timelines matter. Prosecutors often use these minute-by-minute records to establish exactly what happened and to demonstrate that medical staff exhausted every available option before ending resuscitation efforts.
Okay, you put that in her right knee, and you said Dr. Albinger had already put one in her left?
Correct.
Okay. And then, what time was that?
That was at 1502, and then at 1509 is when I performed the ultrasound. Okay. And then at 1510 is when time of death was called.
Okay. And when you performed the ultrasound at 1509, what did you see?
But there was no cardiac activity. There was no fluid around the heart.
Interestingly, the defense keeps this cross-examination extremely short. Rather than challenging the doctor's medical conclusions, the questions focus on what she did not know about the events leading up to the emergency. That's a strategic choice. Sometimes attorneys don't dispute the medical facts at all. They focus instead on how the jury should interpret everything that happened before the victim ever arrived at the hospital. What do you think? Was this witness's testimony mainly about cause of death, or about showing that the outcome was already unavoidable by the time emergency doctors got involved?
Basically no sign of life.
Okay.
No sign that the heart was pumping at all.
Was there any other medical intervention you all could have done at that point to preserve life?
Unfortunately, no. She had gotten multiple rounds of epi, she had gotten IV fluids, she had gotten bicarb, and it was clear that the wounds were no longer bleeding. She had lost a lot of blood.
What does that mean, that the wounds were no longer bleeding from a medical physician?
That means that she had basically exsanguinated already. Usually if you're doing compressions and there's still blood in the body, there's going to be blood coming out of the wound every time you do a compression. And that wasn't happening, which makes you think that she was empty.
Okay. You used the word empty. Was that?
Her blood was gone.
Okay. All right. And what time did you all call her death?
15:10.
I have no further questions.
Cross-examination.
Good morning.
Good morning.
Prior to you jumping in to assist all the other doctors and staff on that day, did you know anything about any of the backstory about how Hannah came to the hospital?
No.
Did you ever find anything out in the course of your treatment or after the fact?
Afterwards, I had heard that her mom was at another hospital.
Okay, thank you.
Mhm.
Anything else with this witness?
No, Your Honor.
You can be excused. Thank you, ma'am.
Thank you.
Call your next witness, please.
Your Honor, the state needs to take up something outside the presence of the jury.
All right. We're going to let you be in recess in the jury room. So don't, leave us your notepads. Don't talk to one another. And we will call you in as soon as we're ready, hopefully in about 10 minutes.